So I am very pleased to have the privilege to introduce Sasha Wasserstrom because as a member of WISN, this is an organization that's near and dear to my heart. But before I start with the introduction, I'm going to read a land acknowledgement that I found from the Duwamish tribe that I just thought was really beautiful. And it says, I would like to acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish people, past and present, and honor with gratitude the land itself and the Duwamish tribe. And then they asked us to say this if we were using their land acknowledgement. It's important to note that this kind of acknowledgement is not a new practice developed by colonial institutions. Land acknowledgement is a traditional custom dating back century for many Native communities and nations. For non-Indigenous communities, land acknowledgements is a powerful way of showing respect and honoring Indigenous peoples of the land on which we live and work. Acknowledgement in a simple way of resisting the erasure of Indigenous histories and working towards honoring and inviting the truth. So in the framework of honoring and inviting the truth, I would like to introduce our wonderful speaker, Sasha Wasserstrom. I hope I didn't completely murder your last name. They are a transnational, queer, gender nonconforming person with Puerto Rican, Jewish, and Greek background. They've been pursuing their PhD in political science with a focus on federal policy that historically contradicts scientific findings and the relationship of these policies to widespread denialism in the public opinion. She is the policy director at WISN. Sasha uses their skills to advance the policy agenda of that organization. And with no further ado, Sasha, the stage is yours.
Thank you so much, Consuelo, and thank you so much to the coordinating committee here at Healthcare for All Washington. Thank you so much, Ronnie, for inviting me, and Ron for the tech, and everybody who has showed up to hear about the Health Equity for Immigrants campaign that WISN, so the organization that I'm with, the Washington Immigrant Solidarity Network, is running with a number of our partners, and I'm really excited to get started. All right. So as I said, my name is Sasha. I am the policy director for the Washington Immigrant Solidarity Network, and I will be talking to you all about the Health Equity for Immigrants campaign. Our objectives for today is to let you know who we are, who the Health Equity for Immigrants campaign is, where we've been, what does this campaign advocate for, what did we do for this campaign in the past, where we are, what are the challenges, what are we currently doing for the campaign, and where we're going. What are we going to be advocating for in this upcoming legislative session, and where can you help us out? Where can you participate in this campaign if you're interested? How can you talk to your legislators about this? So I will jump right in with the next slide. So what is the Health Equity for Immigrants campaign? So the Health Equity for Immigrants campaign is a campaign that includes a number of different community organizations, providers, and advocates that are all working to improve health access and outcomes for all Washington residents. We work to uplift community-identified priorities and address the gaps in coverage and services that prevent immigrants and refugees from receiving equitable access to affordable care. Up until relatively recently, there were around 105,000 immigrants and refugees in the state of Washington that did not have access to any form of health care. Thankfully, that has changed very recently due to the recent budget proviso that we were able to pass in the last legislative session. But we still have a lot more work to do. It is still the achievements and success that we won in the last legislative session is just one step towards full coverage of immigrants and refugees in the state of Washington. So I'm excited to talk more with you about what we won and what we still need to continue fighting for. Next slide, please. And before I move on, I just want to thank the partners that are part of our coalition. So we have a very strong network, not only of folks who consistently provide support for the actions of the Health Equity for Immigrants campaign, but also our core members that are within our coordinating committee. That is the ACLU Washington, Northwest Health Law Advocates, ACRS, Legal Voice, and Columbia Legal Services. All right, moving on. So where did this campaign begin? Well, health access has always been an issue for immigrant and refugee communities. But what really highlighted it was, as you can imagine, the COVID-19 pandemic. So the COVID-19 pandemic and the inequities that were shown all throughout the country of essential workers who a large portion of which are immigrants, many of whom are undocumented immigrants, were left without any social safety nets, while citizens and other members of our communities were able to get direct cash payments. Undocumented immigrants and immigrants of other statuses were not, and were left out of the relief. So in 2020, as things were developing as a result of the COVID-19 pandemic, as I'm sure many of you have heard of, the WIRF, or the Washington Immigrant Relief Fund, came about, which provided direct cash relief for undocumented immigrants specifically across the state. So there were rounds of WIRF in 2020, 2021, and 2022, with an unprecedented amount of $400 million in relief money that went to over 100,000 immigrants in Washington state. Next slide, please. Thank you. Currently, or up until recently, the barriers to health access for immigrants were high and institutional. So with the Affordable Care Act that passed, more than a decade ago, there was actually a clause in the Affordable Care Act that disallowed immigrants from accessing the ACA and the associated insurance exchanges. So immigrants were not allowed to purchase qualified health and dental plans through state exchanges, and were not eligible for various subsidies. Some progress was made on that in December of 2022. This clause, which is called the 1332 clause, was waived. Washington was actually the first state to get this clause waived, to pave the way for immigrants of all statuses to be able to purchase health insurance on the state exchange, and to have access to state subsidies. Still waiting on federal subsidies, but now there is access to state subsidies. Another barrier to health access for immigrants has been the cost of the program and the political will. I would say consistently, we've been told that immigrants and refugee coverage was too costly and too complicated. But we have been organizing and sort of been chipping away at that narrative, which has led more room for growth, but we're still working on it. Our programs are still not fully funded, still not put into law, and we still have more to do on moving the legislature in the right direction. But we did win some big successes, as I was saying. We had a huge campaign win after 4 years of advocating for institutionalized health expansion. This past legislative session, we secured $49.5 million in the budget to be allocated to the Medicaid equivalent, or the what they're calling the Apple Care expansion, for our most vulnerable neighbors. And that program will serve immigrants and refugees of all statuses with incomes of below up to 138% of the federal poverty level. So that's a huge win in getting coverage for our most vulnerable community members. We were excited about all of the wins, but that was our top priority. We also secured $110 million in state funding for Cascade Care Savings subsidies. This was a joint effort with many different coalitions, as it will also fund other folks not outside of immigrant and refugee communities. This $110 million will provide state subsidies for health insurance purchases for folks who have incomes of up to 250% of the federal poverty line. So that's sort of like lower income, but not our most vulnerable. Within this $110 million, we secured $10 million in subsidies specifically for undocumented individuals, which we were also really happy about. And we also had an additional $3.7 million to support outreach, customer assistance, and admin for these new programs. These programs are starting soon. So the budget was passed, I think, what was it, late April, we got the news that this had been allocated to these programs. And we have programs in 2024. Health insurance access to the exchange has opened already. It opened on November 1st. And so all those who can afford health insurance are now able to purchase it, and will have health insurance on January 1st. And the Medicaid equivalent will be up and running in July of 2024. So this is just a timeline, just for, to see it visually. But yes, November 1st, insurance open enrollment open for everyone through the Health Plan Finder. It closes on January 15th of 2024. And health insurance would begin that as soon as folks sign up. And Apple Health coverage begins in July of 2024. So our current challenges that we're still facing despite these successes are that we still do not have enough funding for full coverage of impacted community members. As I said, there are 105,000 immigrant and refugee community members who do not have health coverage at this very moment. And more than a third of those people are projected to be eligible for the Apple Care expansion. However, the $49.5 million that we secured will only cover up to 10,000 people, according to the projections from the various agencies that have been working on this, which means that we'll have at least 20 to 25,000 people who are not covered. This creates a huge equity challenge, as you can imagine. If there are only 10,000 slots, and that's being generous, that means we have to make sure that people have the information and are able to access the sign up at the same time with the same information. Otherwise, folks can be, certain folks in different communities can be privileged over others, and that would be terrible. So what we're seeking to do is address this, but I'll get to that. But so far, we don't have enough coverage to cover everyone. With that said, we also do not have enough funding for community outreach. So far, there has only been $100,000 allocated to community outreach to only 11 organizations across 21 counties. Many counties have been left out. And as you can imagine, $10,000 or less does not go a long way to informing and educating a significant number of people across an entire county. So we are doing our due diligence to try and rectify that as well. And lastly, insurance access costs are inequitable and still too high. So despite having these state subsidies, the costs of insurance for someone who has citizenship versus someone who doesn't, so someone who has access to federal subsidies, is significantly different, and we need to be able to reduce the inequity in the costs for health insurance. All right. So there's some frequently asked questions that we've been answering around coverage expansion. So I just want to breeze through them because there are some of these are pretty detail heavy. So don't mind the wordiness of this. I promise I won't go into every single detail. But just to reemphasize who is now eligible, November 1, all Washingtonians can shop for coverage. We have sort of the income per month and how much folks will need to be able to afford healthcare, in the image on the right. And then Cascade Care plans, folks can receive I think will receive around $250 to help with as their subsidy. And then starting in July 1, Apple Healthcare expansion will begin, and adults age 19 or older will be eligible for that program. So that's around an income of around $20,000 for one person, or $41,000 for a family of 4. So as I said, what is still missing? Full funding, Cascades Care savings, and the subsidies that are not necessarily equitable, and the differences in the costs you can see here. So for customers who are eligible for federal subsidies, it would be some folks would be paying $150 versus folks who are not eligible who would be paying around $250, let's say. We also have inequities with cost sharing. So how much people's what's the word that I'm looking for? How much folks will need to make sure that they have in order to meet their deductibles. That needs to be adjusted. And there's currently no wait list for the Apple Healthcare expansion, the program that will only cover about a third or a fourth of folks who are eligible. All right, we can move on to the next slide. And this is just another slide. I'm happy to share this slide with folks around what the differences in the premium costs are for between someone who is federally subsidized and someone who is not.
Wow.
Moving on to the next slide, we also have eligibility barriers. So folks who are within the 5-year have deferred action. Folks are also currently ineligible for the Apple Health expansion, although they are eligible to purchase insurance on the exchange. So those are other areas that we're going to need to keep in mind as we try and expand coverage and make sure that all who need healthcare are covered. All right. And so what's to come? I've gone over a lot of the barriers, a lot of the challenges, what's missing. And again, I will share these slides out. So if you're interested in some of the finer details that I've skipped through in the FAQs, feel free to look those over. But what's missing and what's to come in the 2024 legislative session, if we can go to the next slide. Thank you. So we're asking for another budget proviso this year to be able to expand and combat these barriers that I went over. So to expand health coverage and to combat the barriers. So what we have done, what the Health Equity for Immigrants campaign has done is devised a budget proviso that we are currently presenting to legislators and the governor's office that highlight sort of the solutions that we see for this this session. So if folks, I'm not sure how familiar folks are with the, with the state's legislative calendar, but this year we have a short session. We're in between the biennial budgets, and it's a little bit harder to get really significant legislation passed. So what we are doing is putting in another budget proviso. We're trying to expand health coverage that way and get as much as we can through that means, while we continue to build on our campaign for the next long session where we will have another biennial budget to have a law or a chance to get full coverage. But for now, what we're doing is we're advocating for increasing funding for Apple Care expansion, so the Medicaid equivalent. We're advocating for around $35 million at this point of additional funding to be able to cover double the amount of people at least than what is projected currently. That is our number one priority, is getting more people covered, as many people as we can. And we're hoping that that doing this, at least adding more incrementally, will help us get to our ultimate goal, which is next year having a fully funded Apple Care expansion to fully be able to cover every person who is eligible for that program. That is our number one priority. Secondary priority is to increase the funding for community-led outreach and a community-led community accountability council. So we want to make sure that the outreach and implementation of these programs is effective and sufficient for the communities that we represent, and that are impacted by these programs. And we want to make sure that this is done in a way that is the most equitable and accountable that it can be. So we are advocating for further funds to ensure that we're able to achieve that goal. Our third sort of priority is to get the wait list, to make sure that there's a wait list so that we don't lose people in the shuffle and of implementing these programs, and so that folks don't fall through the cracks. The wait list is essential for us to just make sure that people do know that they're going to get healthcare, even if they are not able to access it immediately, and that they don't have to do extra paperwork. Because as you can imagine, the folks who are applying for the Apple Care expansion, those are some folks who are working the hardest, who have the least amount of time, and we want to make sure that we're giving them the most support that we can. So we really need a wait list, and right now there's no plan for a wait list. And our last ask that we'll be asking for this legislative session is for the government to provide us with a plan. We want them to write us a report and to tell us exactly how they are going to fully expand our programs. So that means fully cover everyone under Apple Care, under the Apple Care expansion, and how they're going to get costs down in the exchange. And we're asking them to fund that report, so that by the time we reach 2025, we are able to have another budget proviso, or better yet, a bill to be able to fully expand these programs and fully cover all of our community members and neighbors. And I think we're ready. We're good to go to the next slide, our last slide here.
Yeah, I'm trying to. There's something weird going on. Give me 1 second. I don't understand what's going on here. I don't know why I can't do that. Oh, there it goes. Okay. Sorry.
No problem. We're almost at the end. I know I've been talking your ears off, but this is probably the most important slide. That is, how can you get involved? How can you take action? And we have a ton of ways that you can. So one way is to sign in support of the Health Equity for Immigrants campaign. This is a sign-on it's for various letters that we send out in support of the Health Equity for Immigrants campaign. You can schedule an in-district meeting with your legislator, or just a meeting with your legislator, a Zoom meeting, whatever it is. Talk to your legislator about this campaign, about the importance of this campaign, about the importance of supporting this budget proviso to continue the expansion of healthcare to immigrant and refugee communities. You can share your testimony in favor of the Health Equity for Immigrants campaign. So if you have an experience, or you have somebody that you know that you have witnessed suffering from not being able to access healthcare, you can submit your testimony to us at WISN, and we will we'll have that in our bank to be able to share with legislators. You can use this link here to share how your organization. There are other ways that you can participate in WISN's legislative campaigns, including this one through the link on the slide there. We also have bi-weekly policy table meetings where WISN talks about the updates from the campaigns. I think I saw some folks here who attend our policy table meetings. And you can be, you can participate in the strategy and conversations around this campaign and how we win this year and next. And you can join our action network. We send out regular updates on various campaigns that we're engaged in, but also on this one through the link. That green link there. And finally, you can follow us on all of our social media platforms, Instagram, Facebook, Twitter, where we provide updates there as well. And I expect as we get to legislative session, we'll have sign-ons, we'll have legislator meetings, we'll have various actions that we ask our community to participate in if they are able. So the more you're in touch with us, the more you're able to participate as actions come up during the legislative session. So I know that was a lot. Thank you all so much for your attention. Thank you all so much for, hearing me out. I know there's a lot of information there, so I look forward to any questions that you have about all of this. And if there's any more detail I can provide to anything, let me know.
And hang on one second, I'm running into a little bit of technical difficulty here. Okay. So I forgot, being the substitute Ronnie, to say in the beginning that wonderful presentations like this do not happen without a little bit of support. And we are asking, I'm going to turn it over to our wonderful Director of Fundraising and Contributions, Peter Lucas, who will ask us please to support Healthcare for All Washington so we can continue making presentations like this. And while you're writing out checks and getting out your credit card, if you do have any questions, please put them in the chat and we will start going through them. Peter, it's on to you.
Sure. Thank you, Cello. And thank you, Sasha. That was a wonderful presentation. And does everybody have access to the chat? I haven't seen any questions yet. I just want to make sure that everybody can get in there, all the attendees.
There's a question. And it's actually one I had too, about the
Okay.
IDR.
Yeah, so we can put all the questions in the chat, and we'll get to them in a minute after I make my pitch. Well, our organization, we've chalked up many legislative victories in Olympia over the years. For instance, we advocated for the increased funding for immigrant health care in the state budget that Sasha spoke of tonight. So we're aligned with that cause. We also helped to establish and appoint members to the Universal Health Care Commission and to obtain additional funding to support that commission, but it seemed like they didn't have the resources they needed. Now, this entity, the Universal Health Care Commission, could craft a publicly financed universal system based on our bill, the Washington Health Security Trust. So that's what we're hoping for. To learn about our other legislative accomplishments, click on the legislation tab on our website, which is HCFA-WA.org. Now, in order to maintain these kinds of activities and our momentum, it is vitally important that we meet with our legislators, grow our membership, educate the public, and mobilize our supporters to spread the word about universal health care to their families, friends, and most importantly, those in power in Olympia. Now, we can achieve those goals through the hard work of our lobbyist, who I think is on the call tonight, Lonnie, and communications specialist, social media, monthly webinars such as tonight's excellent presentation, meetings with civic groups, and by hosting other events. And understand that financial support of our staff, as well as our other activities and obligations, all require funds. This doesn't all come for free, which is why we are asking you to donate tonight. And our goal tonight is $300. So please go to the links in the chat or on our website and click on the donate button. And you can make a one-time donation, but we're really stressing monthly recurring donations because they provide steady, reliable support throughout the year. So please donate so we can spread the word about universal publicly financed healthcare in Washington. And we are making real progress, but there's still much to be done, and you can help. Thank you very much.
So I would like to start with the questions, and I think Sherry, you had a question. You're muted.
No, I didn't. I was just giving a thumbs up that I could hear or that I was able to get into the chat.
Somebody had a question that they weren't able to put into the chat. Who was that? Anybody? Going once, going twice? Okay. Sasha, do you want to go through them, or would you like me to? What would you like to do?
Yeah, I could just go through the ones that are here in the chat.
Yeah, it's pretty.
Yeah, so what is the 5-year bar? So the 5-year bar is actually a restriction on legal folks who have legal status here in the US. So if someone has legal status, is legally present in the United States, they are barred from receiving from accessing state programs, so state entitlements or welfare for five years. So as you can imagine, that's a long time for someone to not be able to access programs that they need to be able to access, despite being legal residents in the US. And so 5-year folks who are under the 5-year bar and DACA recipients are all ineligible for accessing, in this case, the Medicaid equivalent Apple Care expansion.
And John Britt asks, who will track enrollment?
So who is tracking enrollment is currently the agency that administers Apple Care, that is the Healthcare Authority. So at the moment, they are, they will be managing enrollment, but there is currently not a plan, at least one that has been shared publicly, as to what will happen to those who seek to enroll but do not have, who do not make the cut of the budget, and how they will be accessed or reached out to again, how they will be engaged for the program.
And I have a question about and Lonnie mentioned it too, state programs that access federal funding, where undocumented folks are still not allowed to access this. How will Washington State walk that fine line of protecting those folks that access it in Washington State because it's legal, but it's not legal to access those federal monies?
So federal monies are currently not accessible to immigrants and refugees. So they since they won't have access, they're not really under the radar of the federal government, and the state is not going to be sharing that information with the federal government as to who is accessing the program.
And then we have a couple of questions about involvement. Ronnie Shore asks, are there any specific legislators or committee members that we should contact?
Yes, there are. So we are currently our champions right now in the legislature are Representative Macri and Representative Tai. So they don't necessarily need more pushing, but we do need help with folks on the Appropriations Committee and Ways and Means. So particularly those on the left side of the aisle who have worked with us in the past, they are definitely going to need some pressure to to get them thinking about this again, get them understanding the challenges. I think folks kind of thought that they gave us some money and that was a huge. It was a huge step. It was a big step, but it's not enough. It's not enough for equity. It's not enough for full healthcare for all. So, we need to keep on pressuring them to make sure that the programs are fully covered, and they need to keep on having it on their radar. So, if you have a representative that is on the Ways and Means Committee or the Appropriations Committee, that is on the left side of the aisle, I would absolutely recommend talking to them about this.
Perfect. And Roberta asks, is the sign-on campaign only organizations or is it also for individuals?
So you can sign on, your organization can sign on, or an individual. I think it's both.
And then Ronnie has a question. There must be barriers for immigrants to overcome, like the fear of ICE or employers. What can we, Healthcare for All Washington, and individuals, residents in Washington State who are concerned about health equity, what can we do to help to mitigate those barriers?
That is a great question, and I'm not 100% sure about what that would be for you all, because I think that the issue there is trust in the state. Folks need to be able to trust that the state is not going to disclose their information or make people into a public charge, which could affect their immigration status. I think, something just off the top of my head is if you are interested in sharing some of the materials on your social media that promotes the programs, that could be helpful. Just if folks trust you all, then folks will trust the program. But I think it's really up to the agencies, and that's part of the reason why we're advocating for increased community outreach funding, is because it's organizations like WISN and others who are trusted within communities to communicate this to folks and for the information to be trusted. And that's why we need to make sure that the state understands that immigrant and refugee communities are not the same as citizens, and that's a priority. That needs to be a priority, is making sure that trusted messengers are supporting these new programs.
And then in that, I have a question. Of those 10 CBOs that are going to be chosen for the 10,000 each, or whatever it was, who chooses those 10 CBOs?
So they've already been selected. They've already been selected. There was a sort of RFP process where organizations submitted an application, and I think there's a joint task force between the Healthcare Authority, which is administering the the AppleCare, and then the Health Benefits Exchange, which runs the state exchange. And they selected the organizations based on language coverage, I think, and geography. But we need so much more there. There were a lot of Eastern Washington counties where there are farm workers, farms, a lot of folks that have no representation over there in terms of outreach, and that is extraordinarily concerning for us at WISN, to see that there's no assistance there. So we are, we're asking for not too much, around $3 million for outreach, to be able to fund more orgs, because it seems like it could not go well.
And David Lau just asked a clarifying question. By the left side of the aisle, you must mean Democrats, right?
Yeah, I'm not allowed to, specifically name them, but yes, that's what I was referring to.
Nice slide, David. Are there any other questions? Marcia, Sarah, Sherry?
Well, if I can just ask it or say it, I just mainly have a comment that no wonder this program, the proviso was such a success. I mean, as far as it went, because you are very organized, Sasha. You and the people at WASN. I mean, I enjoyed your slides. They're very well organized. We know exactly what we can do and how we can help you and what you need. So thank you for the concise and informative slides that you presented and your talk too. It's been very informative, very enlightening. Thank you.
Thank you. And I'm happy to, anything that I can do in terms of resources that might help you all in talking about this. We're currently drafting up some talking points that we are going to be using with legislators. I'm happy to share those if that's useful for you all as well. We're currently coming up with specific sort of targets. We can share those lists, once we narrow them down beyond what I just mentioned. So yeah, happy to continue the conversation, and thank you all so much for being here and taking the time to hear about this campaign.
I find myself as one who has been a long time, we're talking over 30 years, advocate for national health insurance, or if necessary, doing universal health insurance in Washington state. And I find myself boggling at the amount of administrative complexity in this program to cover 10,000 or so immigrants. And that the amount of money that's being spent on administration that could be put into healthcare if we just had a system that covered everybody. So I couldn't resist getting on my soapbox, although of course what you are working on is trying to do something now for people who are hurting now. And no matter what, we wouldn't get a universal plan for a while. So it's just a comment, and I really appreciate the work that you're doing in dealing with this Gordian knot of administrative snafu that you have to do.
Thanks, Sherry. I appreciate you noticing that, because it's the complexity of the administration. And as you're saying, we got almost $50 million, and the majority of that is going to administrative costs. And we got $3.7 million for outreach, and only $100,000 of that is actually going to CBO. So it's a mess.
David?
Yes, thank you. David Loud with Healthcare's Human Right Washington, a statewide labor community coalition of which Healthcare for All is a founding and a very good member. I just wanted to let folks know this word of encouragement. Today in the Congress, Representative Ro Khanna introduced the State-Based Universal Healthcare Act of 2023. And this is something we've been working on for years with Jim McDermott, then Pramila Jayapal, then Ro Khanna, and Healthcare for All and Healthcare is a Human Right Washington have both been actively involved in the One Payer States campaign to get this bill launched. And you'll hear a lot more about it soon. And we're going to want everybody's support to try to maximize the congressional support for it. We think really it's a messaging bill primarily for 2025 or 2024, but we want to build a base of support so that if we do well in the 2024 elections, we can actually do something concrete to help states like Washington that want to create a universal health plan while we are working for a national plan, that this will help a lot. So I just wanted to announce that good news.
Well, I just have to say, hip, hip, hooray! Hip, hip, hooray! Hip, hip, hooray! It's finally been dropped. The bill dropped in the hopper so it can be considered. I think my representative is one of the co-sponsors, so I don't have to push him. It's Adam Smith. Yeah.
No, both Pramila Jayapal and Adam Smith are original co-sponsors of the bill.
Yes.
And on that note, if we're talking about Sabuka, and I'm not stealing the show from Wysin, but this is something that maybe we could ask of Wysin. We are looking for organizations to sign a petition in support of State-Based Universal Healthcare Act so that we in Washington State can get one step closer to implementing and remove at least one piece of the puzzle, or get a little bit help on one piece of the puzzle. So I will be talking to you about that if that's okay.
Oh, I can't resist. Sasha, have you ever heard of Tommy Douglas?
I have not.
Oh, right. Here we go. Tommy Douglas once won the contest put on by the Canadian broadcast system, asking who is the most famous Canadian ever. Well, this was about 10 years ago or so, and the winner was Tommy Douglas. So why is he the most famous Canadian? He was a Methodist preacher who was a socialist and became the premier of Saskatchewan in the 1940s. In 1947, he instituted a province-wide system to pay for hospital care for all residents of the province of Saskatchewan. That got some attention. In 1961, he was again premier of Saskatchewan, and he said, let's add physicians' charges to this. And he proposed that all physician services would be covered by the state. Well, the American Medical Association, which has been against such systems ever since the end of World War II, when England put in its national health system, they sent doctors up there to persuade the Saskatchewan doctors to go on strike, which they did. This is in 1961. Did I say that? Anyway, so the province brought in doctors from England who are cross-certified to work in Canada to work during the strike. So the strike only lasted 2 weeks before the homegrown Saskatchewan doctors said, hey, we're ready to give up and get back to work. So the strike ended, and several months later, the doctors said, hey, you know what? We're making more money than we made before because now our patients all have insurance. And that is Saskatchewan was the first province of Canada to set up a universal system. the other provinces looked over the border and said, hey, look what Saskatchewan did. And that's how Canada gradually developed its, all the provinces have their own universal health coverage systems. And in 1984, an overall federal blanket was put on it to provide some standards that all the provincial plans had to meet and to provide some funding. And that is what the Canadians' system is today. So the question is, can Washington State be the Saskatchewan of the United States?
I'm sorry.
Sure, yeah, thank you, Sherry. Just building on that, getting back to Washington, I posted in chat the link to our current action alert, which is actually a message to support Ro Khanna's bill that would give us access to federal funds for our own state plan so that we could become the first state in the nation to do a single payer universal healthcare plan for all residents, including immigrants and undocumented and non-documented. So that's our goal, and matches really well with Wason's goal too, is to get simplified, great coverage for all of our residents. So take a look at that. If you have a chance to click on that link in chat, you can go there and read all about what we're planning to do. And this will be rolled out more in detail to everybody individually in the next coming weeks. So thank you for mentioning that, Sherry,
Great.
and how we can be involved.
Thanks for sharing.
That history was amazing, actually. I didn't know the details of that history where the American Medical Association came in and were, brought in scabs and strike breakers and God. So I think that this is the end of our meeting, maybe. Are we winding up?
So let's thank everyone.
Oh, thank you. Yes, I'm a bad host. Sasha, thank you so much for your wonderful presentation. Everyone, please, we will have access to her slides. We will be posting them. Please go to Wyson. Please sign the petition. Please contact your representative, and please get involved in supporting the health of our workers who put our food on our table. The dirty.
And thank you all
dangerous
again for being here and for inviting me to your space. I really appreciate it.
Yeah, thank all the volunteers, but thank each of you who joined us tonight. Like Sasha just said, thank you so much. Good night.